Hello, everyone, and welcome to Fearlessly Authentic. I'm your host, Jody Harrison Bauer, and today I have my favorite guest of all, Dr. Marko Lujic, who is my hormone doctor and has become a very good friend of mine. He is so knowledgeable about everything. He's been on the show before. If you haven't listened to our episode back, I think it was from July. Go back and listen to it. He is going to break down all the myths, all the truths about hormone replacement therapy, and will answer any of your questions after this episode. Send them in to me, Jody at Jody Harrison Bauer. And we are offering you a 30-minute free consultation with Dr. Lujic. Just use the code Fearlessly Authentic. And I also want to thank you all so much for subscribing to the show. We are now a top 5% globally rated show, and I have you all to thank. So here we go. We're going to get right into it. Marko, welcome to Fearlessly Authentic.
Thank you for having me again.
It is, you are going to be our person for all of our hormone questions. It is Menopause Awareness Month. Were you aware of that?
So I was, and that's a pretty good month. And it's
Yeah.
kind of hitting hard because I was just actually reading a CNN excerpt that their medical correspondent, Sanjay Gupta, was doing
Oh, okay.
on longevity, but also on menopause. And there was a lot of interesting new science
Mm-hmm.
coming out, which if you follow the mainstream media, they haven't really been on top of this sort of thing yet. So I think it's starting to progress into more mainstream knowledge for people to learn about.
It seems like it totally has hit mainstream. Just for the listeners out there, I'm 63 if you were a first-time listener. I am 63 years old. I went on hormone replacement therapy 3.5 years ago, and I feel so much better. And I thought it was too late for me. And I think there are a lot of women out there that do think it's too late. And thanks to social media, we have been able to educate and empower more women, women who didn't think that this was right for them or thought they were too old or too young, right? There are still young people that think, well, why don't I feel well? Well, maybe your hormones aren't balanced. And I'm simplifying that by saying they aren't balanced. There's a lot more to it, and you need somebody who knows how to look at your blood work correctly. So let's break it down, first of all, to explain what is menopause, what is perimenopause, what is postmenopause.
We start with perimenopause, usually 7 or 8 years-ish prior to menopause. Maybe, average onset somewhere between 43 and 47-ish years old in a female. The data is there to say that, but it's who knows? I think the census is hard to get. But in that stage in life, you start to potentially have irregular periods. You have different fluctuations in estrogen, different fluctuations in progesterone, changes in your testosterone, which women have testosterone in their body as well, right? So you have all these hormonal changes, which represent a phase, like your menstrual cycle for your whole life is usually about a 28-day cycle. In terms of your macroscopic view on life, from the onset at puberty of your periods until they stop, that's like a cycle of time, right? So at the end of that cycle of time comes menopause. So that perimenopause phase, things are starting to change. Then in the menopause phase, really what happens is you stop getting your periods. So you stop building up uterine lining and shedding it on a regular basis, which is something you do when you're ovulating and your body's kind of in that baby making mode. And then your hormones essentially bottom out and you stop getting fluctuations in estrogen and fluctuations in progesterone, and you stop getting your period. And through that phase, with those hormonal changes and lack of hormones, you start to have symptoms: hot flashes, brain fog, irritability, weakness, fatigue, appetite changes, metabolic changes, which you might not feel, but weight gain without eating as much, caloric issues in terms of balancing your nutrient intake and what your body stores and might burn from what it was doing before. And then essentially in that interim, your body adjusts to not having hormones. And then you enter postmenopause.
And in postmenopause, basically all those hormones that started working, I mean, we've always had those hormones, but you go through puberty, and you start getting hair places where you never had hair. You grow breasts, your legs change, everything. You start getting into what I always think of as like you're ready to have a baby. Like your body is saying,
Yeah.
my body is prepared to create a life. And
Right.
then your body says, okay, we're taking all that great stuff we just gave you 25 years ago, 30 years ago, and we're now taking it away from you. So remember all that hair you got? Well, now you're going to start losing that hair. Remember you lost that baby fat? Well, now we're going to give it back to you in the middle where you don't want it, and you don't understand why you can't eat the way you ate before and you're still gaining weight. And you think you're actually exercising the same way, but because you're tired all the time and you're moody, you're really not exercising as hard as you used to. So
Right.
it's very confusing. And that's a big, big part of a woman's life. Like if you
Yeah.
think of 13 years old, average age of going through puberty. I know it's a little bit younger now, but let's just say 13. I don't know if I'm right about that, but I think I am.
Yeah.
To say, let's just say average age of menopause before postmenopause is 55. So from 13 to 55, postpartum, maybe, for me, I had two miscarriages, your body is just constantly. So from 13 to 55, how many years is that? 40 something. Think about it. We're like, it's all these different fluctuations. And for a postpartum woman, they know that their hormones are messed up for a little while, and then hopefully they snap back and then they can create another baby if that's what they want to do. But I think the biggest confusion is what women my age and older especially have thought that, well, when you hit menopause, life is over. You're supposed to gain weight. You're not supposed to be attractive anymore. You're not supposed to have a sex drive.
Right.
And we're here to tell you that you don't have to accept that.
The crazy thing to me, like, if you look at life in general, like, time kills everybody, right? And I always use the example in terms of illness. Like, if you went into liver failure, kidney failure, heart failure, muscular failure, brain failure, your eyeballs fail, if anything in your body started failing, the world of medicine would react to it by trying to replace it aggressively. Yet, when a woman goes into menopause and her ovaries fail, for some reason, we're just like, nope, that's okay. That organ failing is fine. And if you let that kind of sit and ferment in your brain a little bit and think about that, that's a problem, right? So if a young woman at the age of, say, 25 lost ovarian function, was truly hypogonadal, not from cancer or anything like that, and you had to remove her ovaries, you would give her back estrogen replacement, right? You would give her back hormones. So why at an age like that is that acceptable to do? Yet in a menopausal woman, independent of any other health factors, we don't do the same for a failing ovarian system, right? I just think it's an interesting thing because it eliminates, in terms of medical responsibility, it eliminates a lot of accountability to the medical profession because we don't have to worry about menopausal women. And once you go through menopause, if you have a heart attack or you develop Alzheimer's or you develop heart failure, we don't really link it to menopause. It's just like, all right, that happened and it's something totally unrelated to the rest of your endocrine system being your hormones. And we just chalk it up to, well, she had a good life and made it to 70. But if we look at what goes on and the chemical differences and then symptoms that can develop on a less outwardly showing basis in terms of like somebody going through menopause, their skin might not change, but their arteries change, their blood vessels change, their metabolism changes, their heart change, their bones change, other things on the inside that you're not seeing that speed up your aging process. And I think we just need to take accountability back as medical professionals for treating menopause like a disease. And it needs to be recognized as a disease the same way in the man's world. If a man can't get an erection because their testicles aren't working well or there's some other disease, that alone will spark a huge uprising, right? But in women's world, you go into menopause and you don't have you have vaginal dryness and no sex drive. It's just not looked at, and that's almost just swept under the carpet. And the more significant health risks aren't even looked at.
Why is that? So why is it because of old school thinking? If we're talking about maybe physicians that are in their 70s now who've been practicing for a long time, do you see this changing? And what can women do to take control and be proactive about their health?
So there's a couple things from a provider standpoint. One opinion I have on it is it takes a lot of time, right? So for me to interact with a female postmenopausal patient, figure out what's going on, come up with a set of goals, come up with a plan for longevity and health and hormone replacement and interacting with the rest of her kind of ecosystem in her body and biologic and physiologic processes is not a 12-minute encounter, right? That's like hours of time. So by default, with a system set up where office visits on average last somewhere between 12 and 17 minutes, you can't really do that, right? So if the practitioner can't spend the time to get the information they need from the patient and take the time to review huge sets of lab data and really analyze it, not superficially glimpse through it, but really take time to go step by step. The time allotted to doing that is not going to be super lucrative to a system that needs to see volume. Number one. Number two, there's not enough practitioners that do it, right? Because especially in the hospital world, which I'm not in anymore, you can make a lot more money cutting something out of somebody or kind of doing a procedure or intervention. So if I prevent a heart attack or vascular disease, that really doesn't make the system a lot of money because preventative care is not lucrative to them. The problem is, I think over time, women just have not been able to have a strong voice in a lot of things. I mean, it wasn't very long ago that women got the right to vote. I mean, it wasn't very long ago that women started attending all male colleges. It wasn't very long ago that women became CEOs of companies. I mean, it's still today a man's world, right? Like if you look across the board at executives and administrators, it's way more on the male end of things than female. So for a female to walk into an office and say, hey, I don't feel good, I need this fixed, and then task the provider to take hours of time to give up to that female in a non-lucrative manner for reimbursement, like it's just not going to work. So women, I think, are gaining traction. I think this process of menopause being recognized as a disease is gaining some momentum. I think people are recognizing it. You know, somebody like me left the system and now I'm deep in it, right? And it took me a little bit of time to see the forest from the trees or the trees from the forest, however you want to look at it, and kind of come to light with myself and the reality of what might be more beneficial to the population rather than just fixing hernias and taking out gallbladders. But as more of us do that and as more of us engage with the female population and give the time to it, I think you're going to have a much stronger force and much better care given. So as a female, you just got to find the right person. If you are still banging your head against the wall with the PCP or OBGYN you've been seeing and they are reluctant to speak to you about hormone replacement, you're in the wrong place, right? So you got to try to find someone that believes in that because it's not voodoo science, it's proven. And we can look through the data and really show the benefits of it on a really great scale. And we just got to kind of buck the system a little bit and search for the care we need.
Exactly. And I think that now women are more aware of the fact that they possibly can do hormone replacement therapy and that they are educating themselves more. But most of the messages that I get is, who do you use and how do I find somebody? Because that's the thing, is that there aren't a lot of people like you out there doing this. There are people that pretend, just like there are crappy coaches out there are crappy doctors out there, and there are people pretending to be hormone experts, and they are not.
And the crazy part is there's a lot of like quick one-offs, like the med spas.
Can we just talk about the med spas? I'm not shitting on med spas, but I just want to say that like those injectables, the pellets, that's just not the answer. Am I right?
Yeah, I don't think that's the answer in many instances. And I also think here's what you got to know. Like if you this world of medicine, you got to do it every day to do it, right? So if you go to somewhere where their specialty is skin treatment or their specialty is hair treatment or their specialty is
Fillers,
something
Botox,
synthetic,
whatever. Yeah.
that's great, and they're really good at that. But if it's a one-off that they're like, oh, we also offer hormone replacement, then I would be very weary of what's going on in there because you need to go somewhere where that's what they're doing.
That's what they do. So if you are, and I always talk about this, like if you want to get a boob job, you're not going to go to a guy who does facelifts.
Right.
You're going to go, and you see that in plastic surgery more and more. Now that plastic surgeons are just in a very niche area where this surgeon does eyes, this surgeon does faces, this surgeon does butts, this person, and that's the way it should be, because if you're doing it every day like you are, that's who you go to. You don't
Yeah.
go to somebody who's a jack of all trades, because that means they're not doing anything excellent.
Yeah, even to the point of I have sometimes interactions with OBGYNs where they say, well, we could do the hormone replacement in our office. And it's like, well, OBGYNs right now are set up to do deliveries, vaginal exams, hysterectomies if they're in the gyn-onc world, take care of the anatomy of the female. They're not set up to do the endocrine end of things. So, like, if they're seeing 30 patients in a day, 28 of which are pre or perimenopausal, but they don't recognize perimenopause because they don't do the extensive labs, and they're just kind of rotating through these people. And then a menopausal or postmenopausal woman comes in 2 out of 30, they're not going to have the time at that point to give to you. And if you look at their daily schedule, the majority of what they're doing is not menopausal care. So if you go to somebody who does menopausal care as a primary focus, that's the person that can probably handle what you need in the best way. And I'm not saying I'm the only one available out in the world of this. I'm just saying make sure whoever you do find, if it is me or whomever, that that's what they do, right? It can't be somebody who's like, oh, well, I do a little bit of OB, I do a little bit of this, and then I do some menopausal care. No, they need to be doing endocrine hormone replacement as their primary focus of care. And then the rest of your body will kind of fall under that. But that's the primary concern in the office you need to go to as a menopausal woman.
So if somebody is interviewing physicians, could you give us a few questions that they should ask these experts or their doctor? And if the doctor cannot answer these questions, they should seek somebody else.
I mean, the first question I would ask is, do you recognize menopause as a disease, right?
Mm-hmm.
And if they say no or give you a roundabout answer, I think you're in the wrong spot. I think you need to ask them, would you be willing to check my hormones on a blood panel to let me know if I'm in menopause? If they balk at that question, you're in the wrong spot instantaneously.
That's
And
happened
that's,
to me. That happened to me before I met you.
yeah, that's probably the best screening question. The second thing is if you say to them, I'm in menopause, I think I need estrogen, and they say to you, oh, no problem, I'll give you estrogen, and they are willing to write a prescription for hormones without checking your labs and the rest of your blood panel, you're in the wrong spot. So between those three things, I think you can really effectively screen your potential treating physician. And without data, they shouldn't be treating. If they're unwilling to get the data, you're in the wrong spot, definitely. And if they don't recognize menopause as a real problem, then you're in the wrong spot. And everybody in menopause should be given a blood panel, lots of questioning about how they feel, and then a potential if they're a candidate for hormone replacement.
I think I mentioned this to you when I started going through perimenopause. When I became perimenopausal, I was 38. And I went to see my primary care, and they gave me a prescription for Prozac. And at the time, I was also diagnosed with hypertension, which runs in my family, right? So what it did was it made my blood pressure go up. And so they did take me off of that. And then they took me off birth control. So I was diagnosed with hypertension, which again comes from my dad. They gave me Prozac, and they wanted to take me off of birth control. So I was like, what do I do? I already had 2 children. I had 2 miscarriages. What do I do? And I think there are a lot of women listening who could probably relate to this story right now. You know, your hands are full. you're either working, you're a stay-at-home mom, whatever it is, you think you're going crazy. They give you whatever they're giving people now for anxiety. And it was a crazy time for me. It really was. I remember that feeling like I was having a heart attack, blood pressure super high. So eventually I didn't take the Prozac, but what I should have been given was I should have had blood work done to check what my hormone levels were. And yes, I
Yeah.
still have hypertension because it's a genetic thing for me, but that's crazy. And I hear that often still in this day. That was when I was 38. So that was 1997 that happened. And it's still happening, I think, because people aren't going to see the right people to help them.
Yeah, and it's a much easier fix just to say, here's some Prozac because, or Wellbutrin, whatever they want to give you, Zoloft, because if that doesn't work, well, then we tried the pills, right? And hormones are a very delicate balancing game. It's a lot of chemistry. It's a lot of time and effort per patient. So you can't just say, here's 20 milligrams of something, take it. It might be every 3 months you need to readjust and you got to follow labs and you got to actually ask the person how they're feeling, and you might have to move meds and adjust diet and lifestyle. Like there's a lot of things in play rather than a simple quick fix. But if you look at the data, the crazy part is that Women's Health Initiative in 2002, prior to that, there were a lot of women, like upwards of 10, 12 million, using hormone replacement and feeling really good. And then, as I see it, a manipulation of the data that they released that said, and I don't know if it was malintent, but I mean, I want to give the people, the scientists who are reading the data and stated that they misinterpreted it, the benefit of the doubt.
Right. That was
But
2002 or 2012, you said.
2002. So their
Okay.
misinterpretation of the data led to them making a statement that
Right.
estrogen causes breast cancer. So now all of the women on hormone replacement came off and all went on psychiatric meds. Recently, they have reviewed that data and come out with a different outcome. So I don't know if it was just the scientists not knowing the experiment they were running and misinterpreting the data, or somehow a pharmaceutical potentially driving financial gains. But they came out with data more recently that completely negates that. And not only does hormone replacement in the form of estrogen, bioidentical, not increase breast cancer risk, it decreases all-cause mortality. So at the end of the day, the benefits are there to be proven. And instead of the quick Prozac, because everybody's still stuck on that Women's Health Initiative. If you go poll, every OB, breast surgeon, or any PCP out in the world of medicine, I would say upward of 85, 90% would still tell you that hormones cause cancer. Because it's like the number one problem in my discussions with patients.
When we did our Instagram live, most of the questions were, I heard it caused cancer, or I
Yeah.
can't take it because I'm too old.
Yeah.
I know we have so much to cover here, and I want you to be on the show more often, but can you explain what estrogen does, what testosterone does, what progesterone does, and why we need those three? Because those seem to be the three most important, or the ones that women hear about the most, and then what else we possibly need. But I think it's important for women to understand what these hormones do in our body, because I think there is a lack of knowledge, lack of understanding of what it does for us throughout our life and why we need it, especially after menopause, postmenopause
Yeah.
also.
So without getting too deep into the science behind it, right?
Right.
Because this is not like a scientific, I don't think the science behind it is necessary in terms of what the people need to know. So as a consumer, what you need to know, and all you need to remember is, how did you feel between the ages of, like, I don't know, 20 and 45, like, right? So just use that as your basis. So if you think about that, and then I'm going to tell you what estrogen, testosterone, and progesterone do in general, because the specifics of it scientifically, down to the molecular interactions, I don't think is necessary for this conversation. What it does, number one, starting top down, is mental clarity, right? Memory, mood stability, emotional stability, general knowledge in terms of your brain function, right? So as you get older, you start to forget things. A lot of it is attributable to your hormones, right? Then we get into bone health, mineral deposit, If you use vitamin D, K, and calcium to make bones, and estrogen and testosterone drive that, that's a big deal, right? Then we look at benefits of muscle health, right? Benefits of
This is still all estrogen, right?
this is kind of all of them: estrogen,
Oh,
testosterone, and progesterone, right? And
okay. Okay.
progesterone specifically, I'll get to at the end. So fat metabolism, right? So the rate at which you use your cholesterol, the good, the bad, and remaking cells, the way you build muscle, and I mentioned the way you build bone, nerve health, nerve conduction, right? And then general metabolic function. So the way you take calories and convert them into energy, which gives you the day-to-day drive, right? And I think if you look at it like that, and you look at the amount of people, I like the transition into that Prozac comment, right? Like, you never needed a Prozac till you were in menopause and you went to ask for help and they said, here's Prozac. Those are actual chemicals in your body: estrogen, testosterone, and progesterone, right? And they interact with receptors in your body that give you the benefit of that feeling of life, right? They drive your energy, they drive your metabolism, they drive your coping mechanisms, your ability to handle stress, physiologic, verbal, mental stresses. They help you deal with all of those things. So really the benefits of them are vast. And then specifically, I will use estrogen because I really like this example. And it's one of the driving forces for me to treat menopause. Statistically, women die in greater numbers of vascular or cardiovascular disease than men. Most of it happens from menopause beyond. They have proven that once you remove estrogen from a female's body, the blood vessels, instead of being compliant with blood pressure, become stiff, like a stiff tube, leading to increased risk of cardiovascular death. So that
Okay.
alone,
Right. So in your 50s, when your tank is being emptied, like
yeah,
literally being emptied, that is when you are at the highest risk for a heart attack or stroke. Is that correct?
that is correct. And that's when women tend to pass away, right? Women live longer than men, actually, in spite of all of this, in spite of our lack of effort to try to keep them alive longer. But more women die of cardiovascular disease. So, like, if the terminal event of your life, is going to be cardiovascular disease or death by blood vessel problems, like, why don't we do everything we can to protect your blood vessels? One of which being replace estrogen in menopausal women, right? Because prior to menopause, vascular disease is not very common.
I can tell you that in so many conversations I've ever had with women, this conversation never comes up. They don't.
No, because if you ask the general population, if I said right now, and for any listeners out there, you can answer to yourself. If I said, as a female in life, what is concerning to you that's going to kill you? And I gave you 3 seconds to think. 9 out of 10 people respond with the C word: cancer, right? It's just the thing everyone's worried about: cancer. Why? Because if you turn on the TV, cancer, 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 cancer. And then every heart disease commercial is some guy, right? Some older gentleman with a gray beard being like, you don't want grandpa dying of heart disease, right? Because it's just an easier sell to the guys: stress, heart disease. But cancer is like the big killer for women, even though
Right.
more men die of prostate cancer than women die of breast cancer in current day, right now, today.
Right. Right.
And so at the end of the day, it's just not a topic people talk about because I don't think it's marketable. It's not sexy, right? Like, if you tell a woman, I'm going to have you avoid a heart attack, they're kind of like, well, not many women have heart attacks. That's still what people think, but it's actually quite the opposite of the truth.
My mom died of a stroke. I mean, she lived 6 years after she had her stroke, but she was completely paralyzed on her left side and was
Which is
bedridden.
vascular disease.
Yeah, she was a little overweight, but yeah, like, to me, that's my fear. But women don't talk about that at all. It's more about other things: sex, sexual drive, libido, and gaining weight. That's what it
Yeah.
seems like a lot of women focus on, and that's what's in the media a lot. And I think it's very, very important that women understand it's what's inside. It's always an inside job, right? We've heard that forever,
Yeah.
but this is truly an inside job.
And this is more root cause, right? Like this is root cause illness, hormone replacement therapy, because you're getting back to foundational medicine, right? It's not truly symptomatic coverage, because if you do it the right way, and if you're really proactive as a female and you get involved in this world in your perimenopause phase, whatever that might be for you,
Right.
and you get coached through menopause, you really won't have symptoms of menopause, right? Those are able to be negated with hormone replacement. So the goal of it is to get
That's
people on.
that's my wish for all of the women listening. That is
Yeah.
my wish. Yeah.
And it's never too early, right? Like it's always good to see where you are, where your hormones are, because like I'll run panels. I mean, I run huge panels on people that are extensive, not just hormones. I mean, everything top down. And along with hormones, you see people with poor cholesterol, poor sugars, poor hemoglobin A1Cs, fasting insulins, lots of different things we look at. And all of it kind of plays together. Like there's a little anecdotal thing I see a lot with insulin sensitivity in the perimenopausal phase when women start to lose a little bit of muscle, right? And you start to see these trends over time in the 43 to 48-year-old population where I can say, all right, listen, we're getting there. We're not there. The next 3 to 5 years, we should really keep an eye on this, because once we do get to the point where you're starting to lose and your tank's emptying, now we can act on it without having the consequences medically, right?
Right. And it's about being proactive. All right.
Yes.
So I interrupted you as you were talking about estrogen and testosterone. What else did you want to add anything more to that? I just wanted to focus on the
No, I
cardio.
think that covered. I mean, it's just all you got to do is remember the benefits of hormone replacement are what you felt like on average out there. There's people that definitely didn't have amazing 30s, 40s, whatever, and that's okay. But on average, your 30s to 50s are usually better than your 65 to 80s in terms of function and quality. Now we can transition that and make that 30 to 85, right? We can extend that with preventative care.
You said something, and we'll go back to progesterone, but you said something about, is there a way that if I was on hormone replacement therapy as I was perimenopausal,
Yeah.
that I could have avoided, and I say that in air quotes, I could have avoided going through menopause?
So you can't maybe you're not going to avoid some transition into menopause
Okay.
in terms of chronologically. But what we can definitely avoid are your symptoms being the night sweats,
The hot flash.
fatigue, the weight gain, the hot flashes, irritability, oversensitivity, emotional instability, the metabolic decreases, like all of those can be coached, right? We can prevent those right through
That's
without a doubt.
that's incredible. Okay.
Yeah.
Where were you when I was in my 30s? Let's talk about progesterone. And then I want you to also explain to everybody listening the difference between bioidentical and synthetic.
Yeah, so bioidentical hormones are essentially the a type of hormone you give someone who is which is the exact molecular equivalent to what is in the body, right? So you don't need to take the medicine and then have your body metabolize it into something else to become usable. Bioidentical means it's body identical, right? It's the exact same thing you would make. So if you took bioidentical any hormone, your body can just use it. Anything given should be bioidentical, and it's available. It's a little bit harder sometimes to get because pharmaceutical companies cannot patent bioidentical hormones, right? Because it's naturally made in the body and they can't really get the patent on that molecule. So sometimes they make synthetics or molecules that have other added substances on it that your body then needs to break down to get the usable form of estrogen, of progesterone. So the key is to get bioidentical replacement. Now, in regards to progesterone specifically, progesterone throughout your life is very important for your menstrual cycle, very important for pregnancies, uterine lining, buildup, and everything like this, right? But in the final stages of life in terms of replacement, the one thing I can tell people, the biggest benefit is if you take progesterone with estrogen as a menopausal female, it is uterine protective, meaning it'll essentially reduce your risk of uterine cancer to 0. Now, there's a little caveat. If you had a history of uterine cancer that was progesterone positive or estrogen positive, that's a precursor to maybe not using hormone replacement, right? That's one of the few. But if you didn't, progesterone is uterine protective. The second thing it does is really helps with hot flashes, tender breasts, fatigue. And the biggest benefit that almost every woman who's on it loves is it helps you sleep at night without a doubt. You take
Yes,
it
it
in
does.
an hour or two before you go to bed, and it is the best sleeping aid out there, natural sleeping aid for a woman to take, hands down.
Since I think we increased my progesterone, I've been sleeping so much better.
Yes. Yes, significantly. I mean, it once you're on the right dose and you're well managed on your progesterone, your ability to sleep is without a doubt. I mean, I've never had a woman complain about it.
Is there, should somebody never take synthetic hormones?
So if it were up to me, I
Mhm.
mean, synthetic's an interesting word because even the bioidenticals are made in a lab. So technically, if you want to get really cute with the definition, synthetic.
Right.
You're talking, if we use the word synthetic for the listeners, we mean a molecule that's not identical to the one we're going to use.
Okay.
I would say stay away from them completely. The reason being, now I know a little while ago we talked about the Women's Health Initiative study. The data that they used from that study to project blame on cancer causing agents and blood clots and strokes and all this other stuff was from synthetic hormones, not bioidentical. That was from synthetic hormones.
Interesting.
Now, if you are for instance, if you are a menopausal woman and you do take a synthetic version of estrogen or progesterone, your risk of clotting, yes, it does go up because it's not bioidentical. No, without a doubt.
Okay.
So in instances like that and across the board, I would say avoid them at all costs if you can. You just got to find the right person to prescribe.
Okay. Oral versus cream estrogen.
So the only time oral bioidentical estrogen is indicated is in a premenopausal woman. I personally would never use it because I don't think premenopausal women really ever need estrogen. And in the menopausal or postmenopausal female, you should never use oral estrogen for one simple reason. Oral estrogen will stimulate an enzyme in your liver, which is very, very active in breaking clot down and processing clots in your blood vessels and plaque. So what it does is it causes embolisms, and your risk of heart attack or cardiovascular disease on oral estrogen in a menopausal woman is significantly higher than just baseline. Whereas with cream-based estrogen that does not get processed through your liver, which is called first pass metabolism, it just goes right into your bloodstream. That is not the case.
And the difference between patch and cream, is there a difference?
I'm a huge advocate for the cream. It's a daily dose. It's easily monitored, relatively easily administered, and the dosing regimen is maybe slightly off, right? Depending on the cream mix and whatever, and there could be some variation day to day, but it's relatively consistent. Now,
Right.
the patch theoretically should be consistent, but these time released patches, if you look at levels in the blood and test estrogen levels or any patch level of medication like that, they fluctuate drastically. And the time release of it, the technology is really not that good. So I'm a cream estrogen or testosterone or injection, intramuscular injection, estrogen, testosterone prescriber.
I'm a huge believer in the cream. I don't like needles. But speaking of needles, as you know, speaking of needles, there is a lot of talk about NADs.
Yes.
or NAD. Can you explain what NAD stands for? I have it in my notes, but it's easier for you to explain it. And how does it help us feel better?
So NAD is called nicotinamide adenine dinucleotide. So just call it NAD.
Okay.
So essentially, NAD is involved in what's called redox, REDOX reactions in the cells. So all you need to know is NAD will essentially carry electrons, which is energy in the molecular system, from one reaction to another in the form of NAD with H, NADH, NADPH. So it's essentially a driver of the energy for reactions in your body to happen. So with that being said, what it does is it essentially promotes energy production and energy use in your body. And that's kind of what the consumer needs to know. Beyond that, scientifically, there's really not a huge amount of molecular data that you need to know as the user. The thing about it is it will essentially help activate and promote the your metabolic function moving forward. So it gives momentum to the train called metabolism.
Okay. So let's just take me, since you are
Yes.
my doctor. Okay. We're just using me as an example.
Yes.
I am on progesterone, estrogen, testosterone. Is that it? There's one more.
Thyroid.
Thyroid, right? And I'm taking now a baby aspirin. And I have talked to you about starting NAD. With somebody who is a postmenopausal woman on hormone replacement therapy, does she need it overall, or is it specific to one person? I know everybody's different, but is this something that would enhance the way I feel even more?
Yes. So if you were to ask me my opinion
Yeah.
purely on health,
Yes.
is it a necessity? No.
Okay.
Would I recommend it to everybody? Yes.
Oh, okay. Okay.
Meaning, it would be very difficult for me to gather data from your body to prove that the NAD I'm giving you is giving you the positive benefit that it should, right? Like,
Mm.
so if I give you testosterone and you feel better, and then I check your testosterone levels and they went up, I can say, all right, Jody, I gave you testosterone, your level went up, and you feel better.
Right.
If I give you NAD, it's almost impossible for me to track, like, do you have more NAD? Do you have higher levels of NAD? Now you can track that in the immediate time frame, but it's going to get used, it's going to change, it's going to fluctuate, it's going to get taken into cells, it's going to get metabolized. It would be very difficult for me to give you quantitative data to be like, okay, your level went up, you feel better.
I see. I see. Okay.
But I can tell you, if you use, and I always say this, a little bit of logic over science, right? Logic always outweighs science. Oh,
Mhm.
every single time. Like we do studies on cigarettes. We still waste money investigating cigarettes.
Mm.
Cigarettes are bad. That's all you need to know, right? We don't need to do science. Who cares on a molecular level what it does? You smoke, it's bad. You don't smoke, it's better. That's it.
Right.
NAD, if you think about it logically, mixed with the science we know about what it does, the benefit of having more of it in your body
Mhm.
is going to help your metabolism. Now, the negative impression on that is, can we prove that it doesn't do anything bad, right? So that there's no risk profile to it.
Right.
And we can, because there is no proven risk profile to having too much NAD in your body.
Okay.
There's a terminal limit of how much you can use, right? So if you get an NAD infusion or IM injection and you overdose on it, you're just wasting NAD,
I see.
right? It'd
I
be
see.
like putting 80 gallons of fuel in a car that only needs 20, you're just wasting 60 gallons. So
Right. I always think of it as like if you sit down and you eat 80 grams of protein, you're not hurting yourself, but it's
yeah,
kind of a waste of taking all
yeah, and
that
if
time
you're not
that
right, if
food.
you're not exercising and using it, what's the point? So
Right.
NAD will, without a doubt, aid your metabolic function as a coenzyme to energy production. There is no downside to it. And just about every single human that I have given it to will tell you they just feel better. It's hard to pin a finger on it. It is more of an energy, emotional state. They just feel better. But it's hard to put a very strict pinpoint on it, right?
I understand that. And again, you should go to somebody who knows what they're doing and not some off clinic med spa. Again, not dissing med spas. They're there. They're wonderful for the things that they do, but see somebody who knows what they're talking about, who knows how
Without
to
a
monitor
doubt.
right. So I would only go to you. And I just don't know if I could put the needle in my leg or butt. So unless it's a really tiny like Botox needle.
We'll get there.
Yeah, we will definitely get there. So to summarize everything that we've just discussed today, hormone replacement therapy, if you are a good candidate, if you are the right candidate for it, can only benefit your life. If you feel that you are tired, if you can't lose weight, if you are crying all the time, if you are stressed all the time, look, this isn't a quick fix. And I think you explained that very well. Nothing is a quick fix. It would be like somebody coming to me and saying, I need, I mean, I've actually turned people away. I need to lose 25 pounds in a month because I'm getting married. I'm like, go see the trainer down the street because I'm not your girl. Um, there is no such thing as a quick fix. This is something that is being monitored all the time. You need to be patient. You need to trust the doctor you're working with and trusting the process. And so if you feel any of these off feelings, whether you are in your 30s, 50s, 60s, or 70s, you need to seek help, right?
Yeah. And everybody is a candidate until proven not to be, right? So like every single female in the world is a candidate for preventative care
Right.
in general. Every single human is. But in terms of women's health, every female can have a hormone assessment and every female is a candidate until screened, right? So if a 12-year-old came in, you could check their hormones. They're probably not going to need hormone replacement. If a 35-year-old comes in, they might need it. 45, they might. 55, they might. 65, almost a guarantee, and beyond, right? So like between 40 and 60, that's like the sweet spot for women. If you haven't gotten involved in your younger years, to really start becoming active with your health, because this should be preventative care. Like this should be the basis of it. Balancing your vitamins, balancing your minerals, balancing your food and nutrition intake, balancing your exercise, and the controller of all metabolism, balancing your hormones, right? I mean, everybody is a
It all
candidate.
comes back to hormones. It controls everything in our
Everything.
body. So, and
It's the
also
brain.
when I was talking about quick fix, and I know we talked about this previously, when I was talking about quick fix, you can't, a lot of women who I've talked to think that it's going to help them lose weight. No, being on hormone replacement therapy isn't a quick fix for weight loss. It's not a quick fix for anything. You still have to have a balanced diet. You still need to exercise regularly. You still need to get enough sleep. But these things will help you maybe get the energy or the
Yeah,
focus to get to the gym.
that's exact, and that's a very, very pertinent statement, right? So you have to kind of do it all together, right? Like you can't just fill your gas tank if your engine doesn't have oil, or you can't just have your transmission fluid and oil filled if you don't have gas, right? Like you need the three. Do they all need to be perfectly aligned for the engine to run? No, but if you want the engine to run perfectly, then they all need to be perfectly aligned. But to get the engine started, you got to have a little bit of each. So if you're on the couch, if you're not moving, if you're eating poorly, if you are menopausal and you feel horrific and you start to move, you start to eat a little better, and we balance your hormones, and they're not all perfect yet, you're going to have the energy to start, and then we can make them perfect, and then you're off to the races.
I love that. I want to start singing "We Go Together" from Greece. That song "We Go
Of course.
Together," like
And
you know
actually, the
this.
people we're talking to should know that song.
Yeah, they should know that song. Okay. But I feel like, yeah, this is like a perfect harmonious thing. You've got the nutrition, the health, the hormone balancing. Again, none of these are quick fixes. So come to it with the mindset that you are being proactive about your health and wellness, your overall health to live the longest you want to live in the best mood that you could be in.
And a lot of people say, I don't know if I want to live till I'm 90. Well, the reason you say that is because people just expect to feel terrible when they get older. But like if you felt like you did when you're 40 or 50 or 60 and you feel really good and you feel the same at 80 and 90, why wouldn't you want to keep going, right? Like if your quality doesn't deteriorate, you're not going to want to stop going.
100%. Absolutely. Dr. Marko Lujic, thank you so, so much for being on Fearlessly Authentic today. How can our listeners reach you?
So we have an email to reach out to, Becca, BECCA, at rtsct.com. So that's Becca at rtsct.com. We have a website at rtsct.com, right? So you can check out the website, www.rtsct.com. There's a medical link in there. And then what I would tell you is if you do reach out and you do email or you do any sort of inquiry into what we're doing, what we'd like to offer from today is a free 30-minute consult. And just let us know that, you heard about this on the Fearlessly Authentic podcast. Now, I will tell you, I do remote consultations. I'm in Connecticut based, but I'm more than happy to talk to anybody, whether it's just questions, concerns. Please feel free to email. Please feel free to reach out on Instagram, reach out to Jody, reach out to myself, however you want to get that, because the more information we can give you on such a spectacular podcast like this, where it's free information to learn where to go get help, I think the more empowered everybody will be, especially women in a phase of life where they feel like they're unempowered.
Love that. Love that. Tell us where we can reach you on Instagram, your handle.
So it's at Lujic, LUJIC _RTS Health MD. So that's that.
I'll put it in there. If you put in Dr. Marko Lujic, it will come up. That's Marko with a K.
Usually.
And you could DM me. Yes. Thank you so much. I hope that all of you realize how much we care about your health and how much we want to help change the way women start taking care of themselves, because it's not too early to start and you're not too old to start.
No.
So thank you again for being on the show. And until next week, everybody, go live your most fearlessly authentic life. Bye-bye.